Well, I'm the dizziness guy. I'm the least favorite guy in all of the clinic populations there. But what I want to show you a little bit about is a struggle we've been dealing with is how to move. Our clinic starts all of the process of a dizzy patient. So if a dizzy patient comes to Mayo Clinic, our clinic is charged with routing them through the different disciplines and which disciplines do they need to see. And so we're in a good spot where we have all of the disciplines, but what's interesting is these patients come in, they have invariably gone to primary care, and then what they do, the next default is going to be otolaryngology or ENT, almost always. And in many of the cases, they do not need to see an otolaryngologist. They've got migraine, they've got anxiety issues. And so the struggle we have is what we're trying to solve is can we route the right patients to ENT, and can we route them to the other disciplines that they need and provide better outcomes. And so what I'm going to show you is a little bit about the innovation that we're trying to do. We're trying to crack this problem. And hopefully start with us and then eventually move it into other systems and go through there. So as I said, when a dizzy patient comes in, again, what they do is they will usually start, they'll present to their primary care physician, and then what will happen is that primary care physician will usually send them on to ENT. We take a case history, and that's almost the order of events. And then what happens if that otolaryngologist doesn't take care of them, they go to another one and they get another balance test. And they will come in with 4 or 5 balance tests, 4 or 5 MRIs, and they still don't have any answer for why they're dizzy. Some cases they do and some they don't. And so the challenge is to get the people that we want in ENT, so we want Meniere's disease or superior canal dehiscence and things that we can do, that we can actually help with, versus the psychiatric issues or the headache issues. All of those that go along with that, the autonomic issues, and I'll show you a little bit about that. So almost 2.5 of patients each year evaluated by primary care physicians have dizziness, okay? It's about 8 million. This was in 1989, so it's a little dated. It's estimated that 26% of 8 million dizzy patients are unable to work. Many of the patients that we see are on disability. They can no longer work. They still don't have an answer after, tens of thousands of dollars in medical care. And again, they showed up, in ENT. Dizziness is one of the top 10 reasons why patients contact primary care patients. And nobody really owns the dizziness space. Nobody says, I only see dizzy patients, okay? And that's one of the problems is they wander around the healthcare system until they finally get to the right place where somebody actually finds out and helps them, okay? And sometimes it is ENT, sometimes it's, sometimes it's not.